Elizabeth Warren has a new healthcare bill that she's pushing. On Twitter, she said the following: "Today I'm introducing the Consumer Health Insurance Protection Act with Senator Sanders and our colleagues. We need Medicare for all, and until we get it, there's no reason private insurers can't provide coverage that lives up to the highest standards of our public healthcare programs." So let me show you a short video here of her explaining the legislation.
Healthcare in America should be about the well-being of families, not the profits of insurance companies and their executives. That's where I am on this. So, I have 3 straightforward proposals that would significantly improve access to healthcare for the 216 million Americans who are currently in private health insurance programs. First, don't let private insurers cheat people. Second, require private insurers to be just as affordable as public insurers like Medicare and Medicaid. And third, when the insurance companies howl that they can't possibly be expected to do number 1 and number 2, call their bluff. Stop the tricks, raise the coverage standards for insurance companies, pretty simple ideas, but I guarantee that the mention of them will trigger immediate outrage from the private health insurance industry. They will claim that these basic protections and standards will put them out of business. They'll stamp their feet, they'll threaten to walk away from healthcare exchanges, and my response, give me a break. Don't tell me that an industry that has $17 billion in profits to hand out to its investors and its executives in a single year cannot do right by the American people. Just don't tell me that.
So not a bad idea. And again, it's not just Elizabeth Warren proposing this. It's also Bernie Sanders. Now, I'm not totally on board, and I'm going to explain why. I think the fact that this is being proposed is a symptom of not only Republican obstinance and corporate Democrat obstinance, but the impulse among left-wingers to compromise and to start moving in the right direction. But doing that without fully building your case in the first place. So, in other words, what I'm trying to say is, listen, there are some things that are not negotiable in my mind. Like, you don't negotiate away civil liberties. That's just not debatable. That's in the Constitution. You know, your civil rights, your human rights, those are things that are set in stone, can never be taken away, not open to the democratic will of the majority. If they willy-nilly want to take away the rights of people, it doesn't happen. Medicare for all is one of those issues where I'm not willing to compromise. I'm not willing to compromise on a living wage. I think it's a ridiculous position for somebody to say, no, I think you should work full-time and still not make enough money to live. Okay, well then you're wrong. And let me take you to a little place called Wrongsville, where you can step out and look around and reminisce on your wrongness. So I don't care if you don't agree with me on that. That's nice. You're wrong. Sorry. There's other things like doing offensive wars against countries that didn't attack us. You could come with a fucking wagon full of rationalizations, but at the end of the day, they're rationalizations, and you're fucking wrong. And you become a war criminal, and you are the bad guy because you are offensively attacking somebody. So not interested in hearing the counter-argument on that front. And the list goes on and on. Free college. That's another one I don't think is debatable at all. Many modern nations have that, and it pays dividends in the long run. And in fact, the investment you put in up front, it more than pays for itself in the long run. But even if it didn't, I value education enough for it to be worth it to do that, to spend our tax money on that. Medicare for all is 100% in that category of no, I'm not budging a fucking inch. Because every developed country has one version or another of a single-payer universal healthcare system. Every developed country. So, with that being the fact, when Bernie Sanders, Elizabeth Warren, or any well-meaning Democrats or left-wingers, when they give an inch, I get angry. Because instead of spending your energy, like right now she's spending her energy, she announced this at some fucking conference and some get-together and, hey, here's my new bill, isn't it great? Well, it's better than what we had, but so was Obamacare. And we all know how that worked out. At the end of the day, do you support the thing that's better than the thing you had before? Yes. But you do a full court press and all systems go and put pedal to the metal for the right thing. So in other words, you're sucking the air out of the room in favor of incrementalism and gradualism when you are not talking about Medicare for all and you're pushing this half measure. And that's what it is. It's a half measure. And even though it's a good half measure and Elizabeth Warren's for it and Bernie Sanders is for it and it would 100% be an improvement, this, I think, speaks to one of the differences in the personalities of right-wingers versus left-wingers, where the left is always looking to compromise and negotiate and meet halfway. And listen, on some issues, yes, you can do that. On other issues, if you do that, you're just wrong. So I would, and here's the point, man. I don't think, now they're trying, especially Bernie's trying, but you haven't really fully made the case yet for Medicare for all. And you should be, instead of talking about this piece of legislation, you should be raising the IQ of Americans on that issue. I want to be able to walk up to anybody on the street and talk to them, and they tell me the facts about Medicare for all. Could you imagine walking up to anybody on the street, Republican or Democrat or independent or anything, and you talk to them and they say, well, yeah, I mean, we should have that because every other developed country has a single-payer healthcare system. Well, yeah, but we should have that because 45,000 Americans die every year because they don't have access to basic healthcare, and that's not a thing in other developed countries. Well, yeah, we should have that because there are medical bankruptcies in the U.S., and that's not even a concept in fucking Canada and Australia and Sweden and Norway and the U.K. and France. So this is what I want. I want people to be able to say, oh, by the way, they spend half what we spend per capita, and they cover everybody. And they get better health outcomes, and they have a longer life expectancy. All these facts that I'm giving you now, I want that to be so deeply embedded in the minds of the American people that they get offended by the notion that some people don't want us to have a Medicare for all system. I want them to be disgusted by somebody who's like, we shouldn't have it. Because they know that person is objectively, empirically, factually wrong if your goal is to have a population that is healthier, to have everybody covered, to stop deaths from lack of coverage, to cut the costs and all that. So that's what drives me nuts, is that by doing this, I know they mean well, but by doing this, they're sucking the air out of the room from the correct answer in favor of incrementalism and gradualism. And I don't doubt for a second that Bernie and Elizabeth Warren are for that Medicare for all system, but I think this is a tactical mistake. Here, let me give you an analogy. It's like when there's already a lot of momentum behind Fight for 15, to switch that out and say, you know what, we're going to go for $10.50. It's like, okay, well, is $10.50 better than $7.25? Yes. Nobody can argue against that. They'd be an idiot if they argue against that. $10.50 is better than $7.25. Duh. But you know what's better than $10.50? $15. So why are you, when there's already momentum and energy behind $15, you don't get to just say, all right, anyway, now we're going to go back to the half measure and waste time talking about the half measure. No. And to be fair to them, they think like, no, this one has a prayer of passing and Medicare for all doesn't at the moment. But actually, no, I don't think either one has a prayer of passing at the moment. Neither one of them has a prayer of passing. So what you need to do is fight for the correct one so that if/when you get a supermajority, it becomes heresy when somebody in the supermajority goes, I'm not in favor of it. You see what I mean? Because you don't want to get the half measure and then have the corporate Democrats go, what do you mean? We did the half measure. That's enough. So while they mean well, ultimately, I don't agree with what they're doing here. And they need to just do a full court press nonstop, never shut up about Medicare for all, because it's the right answer. And I know my generation is sick of these bullshit half measures, because there's an answer out there, and it's the right answer, and it feels like we're doing all the fucking mental gymnastics in the world to avoid talking about that obvious fact.